Hello everyone, my name is John Puryear and I am going to review today one of the PowerPoint presentations that the National Registry of EMTs gave out on the new test for the advanced and the paramedic. So I'm going to use their slides that they gave their presentation by, and they also gave us permission. So there are different categories than there used to have been. It's not like operations, prep, and then medical, trauma, you know, the regular categories like that. Actually, the operations and the prep aspect is only about 10% of the test. And then they added the mega codes as far as the medical patient assessment and the trauma patient assessment into the test. They integrated this into the test where you will have mega code questions. There may be 4 to 6 questions that are having you do a medical patient assessment and or a trauma patient assessment. And there will be different types of questions as well. They're not just multiple choice questions anymore. There are multiple questions, multiple questions. Then you could have matching, you can have drag and drop. There are different test formats on this test now. So I would like to go ahead and present to you what they presented and what they gave us, and then let me see if I can help explain it. So this is their clinical judgment domain sample packet, and they started in July 1st of 2024 with these types of examinations. Now, if you're an EMT, they just started doing this on April 1st of 2025. A new domain of clinical judgment will be assessed. And the purpose of this packet that I'm going to go through is to provide examination content, examples for the advanced or the paramedic candidates. It's for EMS educators, which I am, state officials, and other interested parties. Now, it's going to give you some clinical judgment scenario sample screens, and then I'm going to help review that and analyze that with you. Definitions of clinical judgment, which include aspects of leadership and communications, and then the steps used in the clinical judgment. And then we'll look at some sample items used by the National Registry. Okay. Now, we look at the clinical judgment scenario snapshots, and the examples of the scenarios and items are viewed by the candidate in the testing center. So this is specifically looking at the advanced and the paramedic candidate, okay? So when we look at this, we're going to get this mega code question, okay? On this mega code question, it's kind of divided up to where you've got information, but you'll see at the top left-hand corner, it's the phase of the EMS call. So the one that's highlighted there is en route, okay? So you've now been dispatched to the call, and you are now en route to the scene, okay? So in your patient assessment, you've got to think about all of the steps that you do in your patient assessment, okay? So number one, you're dispatched to a call, okay? When you're dispatched to a call, the dispatcher is going to give you certain information of that call. But now you get that information and you get into your apparatus, say your ambulance, and you're now looking about how you're going to go to that scene. What are the weather conditions? Is it raining? Is it dry outside? Is it freezing weather? Is there ice on the ground? Also, what time of day is it? And what day is it? Is it during the middle of the morning or the middle of the day? Or is it during rush hour traffic? Okay. Then we're going to look at Is it a respiratory emergency? Is it an unconscious person? Is it a cardiac event? It's very limited information that we get. So it's going to be clicked up there that, we are en route. Okay. So then the tab comes on that you're on the scene. And now we're going to look at post. We're going to look at what we're looking at after, what we're thinking about, what is the condition, what did we have. So let's go and look at this question that we have. So right here you can see that the advanced is dispatched to a dentist office for a 32-year-old male who is weak, dizzy, and agitated. The time of the call is 10:15. Okay, that's 10:15 a.m. in the morning. The response time will be 9 minutes. So the advanced partner is with an EMT and a BLS fire department engine crew dispatched with the ambulance. The patient is located inside of the office. There is a heavy rainfall in the area and the temperature is 42 degrees Fahrenheit. A local community hospital is located 12 minutes away and a comprehensive medical facility is located 30 minutes away. So they're saying that this is a clinical judgment scenario. Okay, so you're en route, and now it is asking you what en route information should the advanced prioritize for response and scene readiness. Here we go. Select the 2 answer options that are correct. Okay, so here we are. We're starting to look at what are the 2 most important things that we're thinking about when we're going to be driving to this scene. Okay, so that here are the items that they give us. Okay, so the answers would be time of day, that it's an indoor location, the report of agitation, the weather conditions, and then the engine crew resource. So we've got to pick the most 2 that are correct in this given situation. Well, I've already told you that what you need to look at in the very beginning is how dangerous is it going to be for you to get there. Okay, so we've got the weather conditions that it's already said that it's heavy raining. And then we're going to look at the time of day. And the time of day is 10:15. So that's not rush hour traffic, but that is what I'm going to be looking at. That's what I want to see when I'm going to be responding to the call. Okay. So the theoretical framework for the clinical judgment in EMS, they give us this whole little algorithm here. And we have dispatch, which is en route, right? And then we're going to be having to answer questions when we get on scene. And then we're going to have to answer questions on the post scene. This is all trying to test your clinical judgment and then also your communication. So when we see how this little algorithm is working here, the first thing that we've got is en route to the scene. So we need to recognize the cues. We need to analyze the cues. We need to define our hypothesis, then generalize solutions, take action, and then our evaluation. Okay, so that has to do with being en route to the call. Now, the other thing would be on the scene once we get to that group of questions. So we need to recognize our cues. We need to analyze the cues, then define our hypothesis, generate solutions, take action, and then our evaluation again. So we're right back into that circle. And then the post scene, those questions, we recognize the cues, we analyze those cues, we define our hypothesis, generalize solutions, take action, and then evaluation, and we're back to the top again. So they're all the same things that they're trying to see in your clinical judgment. Okay, these test questions are to see if you truly do have the clinical judgment. You're doing the entire call from number one, being dispatched. Now you're driving to the scene for scene safety. After you've got scene safety, then what are you thinking about? Now you've got to use the data that you have been given by dispatch to start thinking about the different kind of scenarios that could be going on and what do you need to prepare for. And then when you get on the scene, well, then you start your entire assessment from the very beginning to the very end. So you're going to do your general impression, then you're going to do your primary assessment, then your secondary assessment, then your ongoing assessment while you're en route. You need to figure out, is this something that I need to take action right now and treat my patient right now? Well, what will that treatment be? Okay. And then what can I do in the back of the ambulance en route to the facility? So is it something that I need to take action on right there at the scene? Or do I need to get them loaded up into the ambulance and do it en route to the facility? Okay, so that's what this is all looking for. All right, now we've got this other question, and it says, let me get out of the way so you can read it. It says a 52-year-old patient has been experiencing severe chest discomfort and lightheadedness for 2 hours. The symptoms began while the patient was exercising and were not relieved with rest. What conditions are most likely the patient's presentation? Select the 2 answer options that are correct. Okay, so there's our question, and it's asking us to select the 2 answers that could be correct. So by testing your clinical judgment, they actually boxed this this little part of the sentence in there for your clinical judgment that says are most likely causing. Okay, most likely causing. So in that box, it says the complete process of clinical reasoning. That is the thought process a clinician uses to evaluate and sort out a development, and clinical decision making. That is the interference of thought and thought process. The clinical judgment includes investigating, experimenting, synthesizing, critical thinking, decision making, and problem solving to employ a sensible solution for a given medical situation. Okay, so that's it. That's what they're explaining, and that's what they're looking at. Okay, so now this other question on what it's looking for as far as leadership. Okay, so this is en route. Okay, you've been dispatched and you're en route. The paramedic is dispatched to a dentist office for a 32-year-old patient who is weak, dizzy, and agitated. Dispatch report, the patient has a history of epilepsy, diabetes, and high cholesterol. That's what that term means. The time of the call is 10:15. That'd be 10:15 a.m. The response time will be 9 minutes. The paramedic is partnered with an EMT, and a BLS fire department engine crew is dispatched with the ambulance. The patient is located inside of the office. There is a heavy rainfall in the area. The temperature is 42 degrees Fahrenheit. A local community hospital is located 12 minutes away, and a comprehensive medical facility is located 30 minutes away. Okay, so that's quite a bit of information that you're receiving when you've been dispatched. The dispatcher is giving you, and you're thinking about now why you are trying to get to the scene. Okay, so the question says, which of the following action should the paramedic prioritize when en route to the scene? All right, So they're trying to look at leadership. All of these answers have to do with your leadership of how you're already thinking about what you're going to do when you get to the scene. Okay? So it literally says leadership. An EMS practitioner's ability to demonstrate the proper management and guidance of a patient needs in the EMS setting, while using limited resource to improve patient outcomes and to ensure a safe scene. This is done by using knowledge, skills, and acquired competencies. Okay? So, out of that, again, the question is which of the following actions should the paramedic prioritize while en route to the scene? Okay, well, we've got assigning responsibilities. That's leadership. Contacting medical control. We're not on scene yet. Determining the patient allergies. We're not in an assessment yet. We haven't even gotten to the patient. And requesting an additional engine crew. Well, it says in there in the information that we already have a BLS crew that is responding to the scene with us. So, right there in the very beginning, assigning responsibilities would probably be your best answer in that situation. Okay. So, the other thing about en route, we've got this whole thing about the advanced is dispatched to a dentist office for a 32-year-old patient who is weak and dizzy and agitated. The time of the call is 10:15. That's 10:15 a.m. Your response time will be 9 minutes. The advanced is partnered with an EMT, and a BLS fire department engine crew is dispatched with the ambulance. The patient's located inside of the office. There's heavy rainfall in the area. The temperature is 42 degrees Fahrenheit. A local community hospital is located 12 minutes away, and a comprehensive medical facility is located 30 minutes away. So we are still en route, okay? This is en route, and now what are we thinking about? So it says, which of the following is an aspect of this scene that will likely allow for more effective communication that would occur on many other scenes? So they've literally boxed in the communication, and what they're looking at: an EMS practitioner's ability to convey or exchange your main information with peer EMS workers, fellow first responders, and hospital personnel such as nurses and doctors. This is done by using knowledge, skills, and acquired competencies. Communication, likewise, is the ability to communicate to the patient, family, or other citizen individuals found at the EMS setting. Okay, so we're truly trying to communicate all of this. And again, the question is asking which of the following is an aspect of this scene that is likely to allow for more effective communications than would occur on many other scenes. And it's like the patient is a dentist and is responsive. It didn't say that in the information given to us. The patient's HIPAA release form is likely in one place. Honestly, I really don't care about that. Healthcare providers are with the patient on the scene. Well, we don't know that, but that could be, something that who we could communicate with. And close family members are with the patient on scene. Well, it didn't give us that information either. So we're trying to communicate, look at who is probably going to be there that we can communicate with. All right, now clinical judgment steps identified in the framework. Number one, recognize your cues and then analyze those cues. Define your hypothesis, generate solutions, take action, okay, treat your patient, and then evaluate your patient. So all of these have to do with clinical judgment steps that they're trying to test you on to make sure that you know. Okay, so let's go through that. Let's read a question. Let's look at it and see what's going on, because now we are on the scene. You can see up there in the very top hand part, now it highlights the scene. Okay, so we're at the scene and it's now given us this information. So the patient, 60 kilograms, is sitting awake in a dental suite. The patient says, "Just leave me alone now. Get away from me." The office staff states that the patient reported feeling weak upon arrival for the appointment and then became confused. The patient had been instructed to start fasting at midnight for a dental procedure today. The patient has a history of seizures, diabetes, high cholesterol, recently dental pain. Medications include insulin that is being administered by an automated external pump, carbamazine, oh my God, hydrocodone slash acetaminophen, and atorvastatin. The patient has no allergies to medicines. The patient's skin is diaphoretic. There's no signs of trauma. The patient obeys motor commands and moves all extremities. The patient cannot give their name, location, or the date. The eyes are open and the pupils are 5 millimeters and reactive. Breath sounds are clear bilaterally. The vital signs: blood pressure 156/90, pulse 124, respirations 10 with pulse ox 95% on ambient room air, and the temperature is 98 degrees Fahrenheit. The blood glucose level is 47, okay, 47. The end-tidal CO2 is 40 millimeters per mercury. So they're asking in step 1 is to recognize the cues. So a question associated with recognizing the cues identifies germane and important data from the scenario provided details. This will include information about the scene and the scene setting and the patient. So we're looking, at the questions there, and it says step 2, analyze those cues. So a question associated with analyzing cues include organizing, classifying, and matching the recognized cues to a clinical condition from the patient's finding or issues from the EMS setting. Okay. Now we go to step 3, which is to define your hypothesis. A question associated with defining the hypothesis requires the learner to evaluate and rank a working diagnosis from the patient cues found in the scenario encounter. This step includes the possibility of all possible plausible diagnosis and may lend itself to rule out other diagnoses. A scene setting issue could need to be identified. Okay, so then we go to step 4. That's to generate your solutions. A question associated with generating solutions uses the hypothesis to identify all reasonable solutions for improving the scene issue or the patient's condition based on course instruction and sound clinical practicing. Okay, now I want to look at step 5, and that is taking action. Now, a question associated with taking action determines which therapy or action the learner intends to implement based on the previous patient assessments, physical findings, scene findings, and the candidate's clinical judgment. Okay? Now, step 6 is going to be your evaluation. And now we're in the post scene. I'm going to go back and we're going to review all of these. A question associated with the evaluation requires a candidate to assess the observed outcomes to contrast expected outcomes to determine if the critical or scene conditions are improving, deteriorating, or remaining the same. So different types of questions that we have, okay? So again, items in the types that's used during the National Registry certification examinations. Again, I said it's going to be multiple choice, multiple response, graphical, drag and drop, building a list, order and sequencing, and then an options box. Now, before we do all that, let me go back and let's start looking at the possible answers by understanding all of that. Okay, let's go back through those questions really quick. And again, let's look at what we're supposed to be doing. Clinical judgment steps identified in the framework. We're going to recognize the cues, analyze the cues, define the hypothesis, generate solutions, take action, and then evaluation. Okay, so we go back to this scene. We're on scene now, okay? And the information that they gave us is the patient, 60 kilograms, is sitting awake in the dental suite. The patient says, just leave me alone, get away from me. The office staff states that the patient reported feeling weak upon arrival for the appointment and then became confused. The patient had been instructed to start fasting at midnight for a dental procedure today. Okay, here's the history. The patient has a history of seizures, of diabetes, and then high cholesterol, and recent dental pain. Medications include insulin that's being delivered through an insulin pump, right? And that's a big thing right there, because he was instructed to fast, okay? And he's got insulin going. Well, now we're looking at hypoglycemia. And then he also takes pain medicine. Then he's going to take something for his high cholesterol. And then we look at what he's taking for his epilepsy. Now, the patient's skin is diaphoretic. There's no signs of trauma. The patient obeys motor commands, moves all extremities. They can't give their name, location, or date. Their eyes are open and the pupils are 5 millimeters and reactive. Breath sounds are clear bilaterally. The vital signs are 156/90. That's hypertensive. Pulse rate is 124. That's tachycardic. Then the respiratory rate is 10. Pulse ox is 95% on room air, and temperature is 98 degrees Fahrenheit. The blood glucose level is 47 milligrams a deciliter. That's obviously low. And the end-tidal CO2 is 40 millimeters mercury. That's going to be normal. So when we look at the scene question, it says, which of the following findings most strongly suggest a differential diagnosis of a diabetic emergency? It's specifically looking at a diabetic emergency, not really the seizures, right? So select two answer options that are correct. Okay, well, we look at end-tidal CO2 value. No, that's not. Medical history. Yes, that is one that tells me that it could be a diabetic emergency. Their mental status. That's another one that shows us if it's a diabetic emergency, whether hypo or hyper, glycemia. But it shows that the D-stick is low, so we're looking at hypoglycemia, so that one is going to be correct too. And then the respiratory rate or the pulse oximetry. No, those are just tools that we're using to be able to, to be able to diagnose our patient. So the two that are the most correct would be the medical history and the mental status. Okay. Now we go to the scene. We've got the same scenario that's going on. Okay. And now it says, what are the most likely causes of the patient's current condition? And select two answer options that are correct. We've already identified hypoglycemia, right? So out of that, we've got our answers: hypoxia, advanced myxedema, Really doesn't have to do with that endocrine problem. Atorvastatin side effect, that's for the high cholesterol. No. Insulin dose management. There's a big one right there because the pump is still active. It's actively pumping insulin and he hasn't eaten. And then E, fasting to prepare for surgery. Those are the two main things having to do with the hypoglycemic effect. So it would be D and E. Okay. Now, we're still in this dental suite and it's still the same thing. Okay. So now this question is asking, based on patient findings, what is the most probable medical emergency and what is the most appropriate treatment for that emergency? So now you're going to drag and drop. It says move the most probable emergency in the answer area and then move the most appropriate treatment into the answer area. So we've got there at the top opiate overdose. No. Hypoglycemia. Yeah, and then hypoxia. So we're going to select hypoglycemia. Now, the treatments we would do for hypoglycemia is administer a dextrose solution. Okay, yes. Administer intranasal naloxone. Well, he's taking hydrocodone. I understand that. It could be that condition. And then administering high flow oxygen. All right, well, that's airway and oxygen. His pulse oximetry is 95% on room air. Now, here's the post scene. Okay, we chose to give some dextrose, right? And it says post scene. After receiving a dextrose administration, the patient pulls out the IV line. And now the patient says, "Where am I at? What are you doing to me? My head is spinning and I can hardly keep my eyes open. I'm going to throw up." The patient vomits. Now, the patient has pale, cool, diaphoretic skin. They're not following commands. Their eyes are open and the pupils are 5 millimeters and reactive. The vital signs, blood pressure 160/92, still hypertensive. Pulse rate is now 130 beats in a minute. It's gone up. Respiration's 12, pulse ox 95% on room air, temperature 98 degrees Fahrenheit. Blood glucose level is now 52 milligrams per deciliter. So it did go up, and the pulse ox stayed the same the end-tidal stayed the same at 40 millimeters per mercury or mercury. And now the question is asking, which of the following medications should the advanced most strongly anticipate administering to this patient? Well, we've got fentanyl for pain management, naloxone maybe for an overdose of an opiate derivative drug, oral glucose administration because the advanced cannot give, IV dextrose, only the paramedic can, and or ondansetron, which is Zofran, an antiemetic. So looking at the advanced, when you've got a blood glucose at, 52, and they're at least awake, we don't know how well, are we worried about them aspirating, yes or no? So you would have to pick the answer that you believe is the correct answer in this given situation. Now, as a paramedic, it says after receiving the dextrose administration, the patient pulls out the IV line. It's all the very same question as we just read. But now the question says, because of these changes in the patient's condition, which of the following actions would be the most beneficial? Select the two answer options that are correct. Okay, so it is deliver a fluid bolus, provide high flow oxygen, discontinue the insulin delivery, administer a narcotic agonist like naloxone, and sit the patient upright, leaning forward. Okay, well, What do we think that we're going to do? We see the monitor and it is sinus tachycardia matching the mechanical pulse rate, right? So, I mean, they're tachycardic for some kind of reason, but they're hypertensive. I wouldn't want to give a fluid bolus to this patient. I would want to give, the high flow oxygen. If I can disable the oxygen delivery, the insulin delivery pump, I would probably want to do that too. And then administer Narcan and then sit the patient upright. It's giving some correct answers, but you only have two correct answers that you can select. Now, on this post-scene question, it's still the same thing. It's still the same question that we're dealing with. And now it's looking at the advanced. Suppose the advanced performs a reassessment. Which of the potential changes to the patient presentation listed below would indicate that the patient's condition is improving, and which changes would indicate the patient's condition is worsening? So you need to select the changes that you would indicate the condition is improving and select two changes that would indicate that the condition is worsening. So this is a different type of question and answer aspect. So the answer area, it says that the heart rate increased to 140 beats a minute. So would that be that the condition is improving, which is the first one, or would it mean that it is deteriorating, the condition is worsening? Well, that would mean that the condition is worsening. The patient starts to follow commands. That would mean that they're improving. The skin becomes dry. Well, that would mean that they were improving if it was a hypoglycemic patient. And a tonic-clonic activity is observed. Well, that would be a worsening condition in that situation, right? Okay, so we talked about the different types of the questions and everything, and now let's go through that so I can show you the different questions that they're going to have. Here's one that is a multiple choice question. It's going to give you the question, and then you've got 4 answers, and you have to find the one that is most correct, okay? A 40-year-old patient fell from a roof and is unresponsive. Their vital signs, 190/110, okay? The pulse rate is 44 breaths in a minute. That is Cushing's triad, Cushing's reflex, right? Respiratory rate is 28. Pulse oximetry is 91% on room air. So what is most likely causing the vital signs? Well, if you know your signs and symptoms, then you'll know that this is increased intracranial pressure. So there's all 4 answers there, and I just answered it in my head. So I now want to go pick that answer, and it's A, increased intracranial pressure. All right, here's another one that is a multiple test question, a multiple response. So now it's going to ask you to pick the ones that are correct. A 52-year-old patient has been experiencing severe chest discomfort and lightheadedness for 2 hours. The symptoms began when the patient was exercising, and it's not relieved with rest. What conditions are most likely causing the patient's presentation? Select the 2 answer options that are correct. Okay, so it just said there are 2 correct answers, and you need to be able to figure out what that is. Well, acute pericarditis, pulmonary embolism, myocardial infarction, exercise-induced asthma, or spontaneous pneumothorax. Okay, so they had experienced severe chest discomfort for 2 hours and lightheadedness, and it occurred when they were exercising. And now it doesn't stop, it doesn't get relief with rest. Well, I know the answer. That would be a myocardial infarction. That is not angina because it's lasted longer than 30 minutes, right? Not relieved with rest, oxygen, or nitroglycerin. So it could be a myocardial infarction. And then it was a sudden onset, right? And so that could be a pulmonary embolism in that situation. All right, now we've got another question that is graphical. So it's a 19-year-old patient has difficulty breathing after having an argument. The patient's vital signs: blood pressure 140/90, pulse rate 116, pulse ox 95% on room air, and end tidal CO2 38 millimeters mercury. The patient's waveform capnography is shown below. Okay, this is a question about waveform capnography. Okay, so then we've got these answers that we can look at, and it says, what does the waveform indicate? Normal morphology or abnormal morphology? That's all it's asking you. So A, normal morphology, because the waveform is box-shaped and consistent. B, normal morphology, because the rate of the waveform. Abnormal morphology, because the waveform is box-shaped and inconsistent. And abnormal morphology, because the rate of the waveform. Okay. So looking at this, I've got to be able to pick one answer, right? It's a multiple choice, but it's looking at the capnograph, and I need to know what is normal. Square waveforms are good. Shark-finned or rounded waveforms are bad. And it needs to be between 35 and 45 millimeters mercury. So when you look at that number up here, it is going to be, well, it already talked about it, and it said that it is 38 millimeters mercury. So that's low, but it's normal. It's within the normal range, okay, 35 to 45. So I would pick A, normal morphology, because the waveform is box-shaped and consistent, okay? Just kind of helping you out on the questions. Now, there are also drag and drop, like the question that we looked at before, and this guy who is in the dental suite who is hypoglycemic, okay? So it's kind of asking you over here, it's giving you, medical emergencies. You've got to pick out what would be the case, what's causing this situation. So it's either opioid overdose, hypoglycemia, or hypoxia. So you're going to get the right answer, hypoglycemia, and you're going to drag it over here that says the most probable medical cause. Okay, then we're going to treat hypoglycemia, and it says administer dextrose solution, and I know that's what I need to do. So out of that, I'm going to drag that into the proper answer. Okay, another type of question that they give us. There's another one that is a build list, okay, and this is in the post-scene. So it says, after receiving the dextrose administration, the patient pulls out the IV, and now this is where he is confused and all this other stuff, right? The question says, what conditions are likely to explain the patient's continued signs and symptoms despite appropriate treatment? Move each option into the answer area and order the conditions from the most likely to the most or from the most likely to the least likely explanations of the continued signs and symptoms. And then they have selected up there seizure, diabetic emergency, and respiratory distress. So you're literally going to have to build this. You're going to have to pick which is the number one most likely that we've got here. And then we're going to build them, and we're going to put them down here. We're going to select them in that little drop down menu. Okay. So diabetic emergency, because his blood glucose level is still low. It could also be seizure activity, because he has a history of seizures. And it could be respiratory distress. Well, his pulse oximetry is 95% on room air. That may be the least likely that we have, okay? And then we looked at the question that is selecting whether it is going to be consider getting better or consider worsening. And then it gives us our answers over here that we've got to select that. So heart rate increases to 140. Okay, well, that would be that the condition is worsening. And then we've got the patient starts to follow commands. Well, that would be a better. That would be, it would be, it's increasing, it's getting better. The skin is dry. Well, that's better. And then the tonic-clonic activity is observed. Okay, that's worsening. That's not getting any better, right? Okay, so I just kind of wanted to review this for you. And they say that for further details, you can look at the articles, A Proposed Theoretical Framework for Clinical Judgment in EMS. And they actually have that on the website that you can look at, okay? So again, just something that you can use to be able to help you in that situation. Okay, well, I've reviewed that pretty quickly, but I've had a lot of people asking me about how do you take a test. They ask me if my class is following this new testing format, my 16-hour NREMT prep. I've got the EMT and the advanced paramedic versions. I teach the material in my class. I do not teach how to take a test. Okay, I don't review questions and possible answers in my 16-hour NREMT prep. I teach the information so you know the material. Okay, you actually get it and you understand it. We start from the very beginning of the book, and I'm going to hit all the highlights, and I'm going to teach all those topics to the very end of the book. So when you're done with my class, you're going to gain the knowledge. Okay, you're going to have the knowledge. You're going to know the material to know the correct answers. That's what my class is going to do. And I'm telling you, even if you think that you know the information, when you're done with your EMT, advanced or paramedic school, it may still be floating around out there inside of your brain. My job is to help you identify where your strengths, your weaknesses are, so that way you don't spend any time restudying the stuff that are your strengths, but it identifies where your weaknesses are, where you need to bone up and actually study a little bit more on. Go back into the textbook, go back into your class notes, your instructor notes, whatever else that you have. So that's what my class does, okay? And I also recommend that you find a good product that will teach you, give you practice questions that you can take to see how you're answering the questions. I just don't do that. I don't want to write test questions. My specialty is actually teaching the information to where you get it and you understand it and you know why it's acting abnormal. Okay? So thank you guys very much. I really do appreciate you listening and taking this class. And if you can, please go to my website at www.johnpurrier.com or www.nationalregistryprep.com. Okay, that's where you're going to be able to see me. Thank you very much.